Well, welcome everybody. Thank you so much for joining us today and for attending today's webinar, Advancing Equity in Early Childhood Philanthropy. It's the third in four of a webinar series hosted by Healthy Kids, Healthy Future. And we are so glad to have you here. We know that some of you may be dealing with weather, and we appreciate you taking the time to join us today. I would like to start by thanking our partners at Healthy Eating Research, in particular Megan Lott and Lindsay Miller, for their partnership in planning this webinar series. Before we begin, I wanted to cover a few housekeeping items. We will begin recording this webinar and sharing it publicly. We will also share the presenter's slides after the webinar. You can submit your questions at any point during the webinar using the Q&A function, and we will respond to them at the end of the webinar as time allows. Next slide. First, I have the extreme honor of introducing Nemours, where I work. Nemours Children's Health is one of the largest integrated pediatric health systems in the country, and everything we do, our medical care, research, education, and prevention and advocacy efforts are focused on kids. Our goal is to help children everywhere grow into healthy adults. And to do this, we think of health as more than just medicine. Good health involves education, food, housing, family stability, emotional well-being, equity, justice, and more. And that's why we go outside the walls to reach children where they live, learn, and play. And as I mentioned, we have the great honor of partnering with Healthy Eating Research, whose mission is to support and disseminate research on policy systems and environmental strategies that promote healthy eating among children and advance nutrition and health equity. Next slide. A little bit of a background on Healthy Kids, Healthy Future. Many of you may have been involved or heard of us in the past, but we started in 2009 when Nemours Children's Health and the Centers for Disease Control and Prevention partnered to launch Healthy Kids, Healthy Future, which was a national movement to really promote health and prevent obesity in children birth to 5. And to support the ongoing collaboration among experts in the obesity prevention and early care and education fields, Nemours and the CDC formed an expert group of national leaders from the obesity prevention and ECE fields, many for the first time. 10 years ago, it was a very different landscape than we see today. And so Healthy Kids, Healthy Future hosted national conferences in 2009 and 2016 to advance policy, practice, and research in early childhood health promotion and obesity prevention. And that leads us to this webinar series here in 2022. Next slide. Through our discussions with our partners at Healthy Eating Research about the impact of the pandemic on the health and well-being of young children and families, we determined that there was a need for both the obesity prevention and early care and education fields to take stock and really assess where we are now to advance child health equity by better addressing food insecurity and childhood obesity. And to foster this discussion, we developed this 4-part webinar series to share the insights of leaders in the space on how to leverage early care and education settings to achieve equitable health outcomes by highlighting opportunities and advances in policy, research, philanthropy, and innovation. The policy and research webinars happened in the spring, and we have since released 2-page briefings about what happened at those, as well as recordings and the slides from those, and encourage you to look at those. We can drop into the chat where you can find those from the links. Today is the Philanthropy webinar, and we hope that you will join us for the Innovation webinar, the final webinar in the series on October 26th. Next slide. And so an agenda for today, we will have presentations from 3 great speakers. Then I will moderate a conversation between the speakers before opening the discussion to questions from the audience. But as I mentioned, please feel free to send in any of your questions using the Q&A function at any point during the conversation. So I'm excited to jump into the presentations and to introduce our first speaker. Jamie Bussell is a senior program officer who joined the Robert Wood Johnson Foundation in 2002. She is an inspiring hands-on leader with extensive experience in developing programs and policies that promote the health of children and families. Her work focuses on ensuring that all children have the building blocks for a lifelong health. And for many years, Jamie has provided strategic leadership in developing the Robert Wood Johnson Foundation's approach to supporting a healthy childhood, stressing the importance of ensuring that all children have access to healthy environments that support healthy weight. She has also led high-impact national programs, several of which ultimately influence the development of federal programs. Jamie, thank you so much for joining us.
Thanks so much, Allison. It's great to be here. Good morning, good afternoon. I hope everybody is safe where they are. So the Robert Wood Johnson Foundation is actually celebrating our 50th anniversary this year. Our institution-wide efforts to build a national culture of health are rooted in equity that provides every individual in America with a fair and just opportunity to live the healthiest, best life possible, no matter who they are, where they live, or how much money they have. The Robert Wood Johnson Foundation works with others to identify, understand, confront, and remove structural barriers to health and well-being, including racism, powerlessness, discrimination, and their consequences. And we do this by supporting research, programs, policies, practices, all aimed at bringing about meaningful change and improving the lives of everyone in our nation now and for generations to come. Next slide, please. So that's a little bit about the foundation, a little bit about me, and thanks, Allison, for the lovely introduction. I'm a senior program officer at the foundation. I direct our efforts to prevent and address childhood obesity. I've worked at the foundation for 20 years, which is hard for me to imagine, and I've been involved, actually had the really good fortune of being involved in our obesity prevention work over that entire time. So these days, I spend a lot of time thinking both about the foundation's legacy as well as our evolution. I also have the good fortune of working on a team called Global Ideas for U.S. Solutions, which looks for inspiration from around the world and identifies programs, policies, and practices from other nations that have the potential to be implemented here in the U.S. And clearly, I think the world has a whole lot to teach us, especially when it comes to obesity prevention policy. Next slide. So I thought what I would do in my next 15 minutes just to spend most of the time sharing two things. First, a description of our past investments in the space and some of the impacts that I believe we've had. And I say we, I mean the collective we, not the RWJF we. Secondly, how our work on obesity in early childhood has really influenced other efforts at the foundation. And after that, I'll share some questions that guide and propel our work related to early childhood and childhood obesity generally, and describe how we are changing, how we work as a funder in the obesity space and beyond. And then I hope to wrap up with just some general reflections about our collective work and what I think is some pretty encouraging news about the impact that we all are having on the lives of kids and families in our country. Next slide. So how does early childhood fit into our obesity prevention work? Well, to be totally honest, it didn't when we started out in the early 2000s. Well, the Robert Wood Johnson Foundation had been investing in childhood obesity prevention strategies since 2003. As of 2011, only a very small percent of our overall portfolio dedicated to childhood obesity was really focused in the early childhood space. In fact, most of our efforts back then were really focused on school-age kids and school, for that matter, as a setting of interest. So back in 2010, we commissioned an internal assessment of our childhood obesity work, which resulted in 3 recommendations to address gaps in our overall approach. One of those recommendations was to think strategically about investments in early childhood. We committed ourselves to early childhood obesity prevention from that point forward, and really to healthy nutrition right from the beginning of life. So beginning in 2011, we initiated what I would say has been a fairly productive run of investments in early childhood. We focused very much the way we focused historically on a lot of the work and a lot of the issues that we've undertaken, continuing to build the evidence base, accelerating the adoption of evidence-based early childhood obesity prevention policies at multiple levels, and increasing the capacity of the field and early childhood providers to take action to implement those evidence-based policies and practices. So I'll offer just a few examples of each. Next slide, please. To help build the evidence base for early childhood obesity prevention efforts, and Allison introduced healthy eating research, we invested in healthy eating research, or otherwise referred to as HER. HER, along with its many researchers, partners, and grantees, has really been a pretty essential engine behind improving early childhood policy and practice. Next slide. So the foundation's original early childhood funding to healthy eating research was very specific to early care and education centers. In fact, HER's early work really focused on things like state child care licensing regulations, on areas around nutrition, physical activity, and screen time. And it was at about 2015, we began to expand to look more at other early childhood settings like home visiting and WIC, as well as looking at the community context and built environment. We also began to focus much more on barriers to nutrition and equity, rather than just on obesity prevention, and expanded our target age to include 0 to 5-year-olds and pregnant and breastfeeding parents. Today, our early childhood work includes kids up to the age of 8 and emphasizes policy, systems, and environmental change strategies at multiple levels and at multiple settings. Since COVID, healthy eating research's work has also focused on the impacts of the pandemic and related policies on families with young children. Next slide, please. So HER has also initiated what I would say is a really sort of fundamental key mechanism for reviewing evidence and developing evidence-based recommendations. They've convened 3 what they refer to as expert panels over the last several years to examine 3 specific areas of particular interest that are outlined in the slide before you. For each of those areas, HER also developed parent-focused materials, and for the most recent one on feeding guidelines for kids between the ages of 2 and 8, also launched an Instagram account. HER has influenced the field with its funding and continues to be shaped by the broader field as well. Healthy eating research's current CFP is an outcome of this evolution. So they're funding timely research on how COVID-19 related relief and recovery policies and a post-pandemic economic slowdown impact child health and well-being. We have supported the changes in the field. And so, as the field's changing, we're also changing as well. Next slide. Now, in the policy arena, Voices for Healthy Kids, which the Robert Wood Johnson Foundation developed in partnership with the American Heart Association and launched back in 2012, has done a lot of work to advocate for healthy early childhood policies. Voices advocacy infrastructure is helping to advance healthy, equitable policies on a whole range of issues to help kids grow up healthy. Its early childhood policy priorities include updating state or local child care licensing requirements to include specific provisions around nutrition, physical activity, and screen time, to secure state and local funding for quality early care and education, Head Start and Early Head Start, to support family economic security, health, and well-being through policies like paid family leave. Next slide, please. Over the last decade, Voices for Healthy Kids has secured some pretty notable wins. They funded 290 state and local advocacy campaigns, and those campaigns have achieved nearly 350 policy wins. They've generated more than $5 billion on public appropriations to advance these goals. And those totals encompass everything that Voices for Healthy Kids is working on, not just early childhood issues. So I wanted to lift that up. Next slide, please. In addition to the movement building and partnership successes, Voices for Healthy Kids also helped secure over 30 policies passed specifically in the early care and education arena. And I could probably spend an hour talking specifically about those. I'll just take a chance to lift up one. In New Orleans, Voices for Healthy Kids helped support the ballot initiative that approved new property tax that's expected to pull in more than $20 million annually for early childhood education, creating enrichment opportunities for an additional 1,000 infants, toddlers, and 3-year-olds. Next slide, please. So this presentation actually forced me to kind of go back through many years to kind of lift up some of what we had supported years ago that was in my distant memory. And so it was really interesting. I lift up this as an example. We've worked with the American Academy of Pediatrics many years ago in a series of policy roundtables to identify policy opportunities to prevent obesity in early childhood. AAP hosted these roundtables about the root causes of disparities in obesity rates among kids. And among the key insights to come out of those convenings were that to be effective, policies must address poverty, institutional racism, cultural competency, systems integration, and really center the voices of families. These findings, which were actually back from 2015, reflect much of the foundation's work today that's supporting healthy kids and families and ensuring that all kids and families can thrive. I have a whole bunch of other examples, but I think in the interest of time, let's go to the next slide. Finally, we've also supported the field through capacity building and communications related efforts. I won't go through all of these, but perhaps I'll just lift up the National Academy of Medicine's roundtable on obesity prevention, which got started back in 2014. And it's really helped shift thinking among its members and the field on upstream factors related to childhood obesity prevention using a system science approach with a very deepening focus on the impact of structural racism, biased mental models, and social norms on childhood obesity disparities. Next slide, please. So we build our early childhood strategy on 3 prongs of evidence building, policy, and practice development and advocacy. But our early childhood obesity prevention work has also impacted our own evolving focus on children, parents, and families. This bidirectional influence, that is our influence on the field and certainly the field's influence on us, is significant and it's sort of continual. And it's predicated on a few foundational principles and practices that I just wanted to lift up. The first is around dialogue with our grantees, with experts, both with lived and learned experience to better understand and give voice to perspectives, issues, lived realities, and opportunities. Shared learning through the kind of evidence building work I talked about earlier, as well as more informal exchange. And connection building across our work, across fields and sectors, and with other funders through convenings, communications, cross-sector collaborations, and initiatives. So I'd like to just share 3 specific ways in which this work has really influenced the foundation's overall investments sort of at the enterprise level. I think it's fair to say that our obesity work has really helped shape the foundation's broader vision around health equity and building a culture of health. And even as we made progress on healthy eating and physical activity, we increasingly have understood that obesity is a symptom of larger challenges that families face in their communities. Second point is that our early childhood work is really reflected now in one of the major thematic areas at the foundation called healthy children and families. The work of that theme is really focused on shifting mindsets around who is, quote, deserving and advancing policies to promote economic inclusion for kids and families. And I think you'll note that there's a direct connection between some of what got surfaced at the American Academy of Pediatrics roundtables almost 7 years ago that I mentioned, and that theme strategy today. And then the final example, I think that some of our early childhood obesity focused work, whether it was on breastfeeding and maternal nutrition, in some respects, we could see as sort of the antecedent to work across the foundation now that's really focusing on birth justice. Next slide, please. So as funders, and probably my fellow funders, I would think, some of this is going to resonate. As funders, we ask ourselves and our partners and our grantees a whole lot of questions. Preparing for this presentation, I looked back through our early childhood obesity focused work with a particular eye to the kinds of questions we were asking and seeking to answer in our role as a philanthropy. In the early childhood obesity space, here are some of the questions, that I have on this slide that have really animated our thinking and our work. I'm not going to read through all the questions, but we ask these questions of ourselves and to our grantees and our partners and other funders. In this area, we did a fair amount of dialogue and discovery to better understand how we as a funder could add value, coming from a place of real humility and acknowledging the tremendous amount of expertise, both learned and lived in this space. Our efforts to address these questions have really helped us move forward and to consistently interrogate some of our assumptions and our work for that matter. Next slide, please. So I'm going to slowly try to wrap up, and you can actually advance this slide because it's animated, so there's a bit more coming. So yeah, I think one, yeah, perfect. So as a funder committed to health equity, we continue to evolve our work along with the field and society. And so now I'm going to just shift gears for a minute because Allison said this would be okay to talk about, and shift gears a bit to talk about where we are with our obesity work specifically, which I'll say is ever evolving. We've learned a lot over the past 2 decades. This learning has moved us to think about childhood obesity, not as an outcome, which I think historically was the way that we had thought about it, but really as an indicator. And this is a pretty fundamental shift for us. It moves us from thinking about obesity as a siloed issue and a set of investments towards really thinking about it as a key symptom of community conditions and systemic inequities. And this is not our unique insight alone. In fact, many others who've been working for a really long time in the equity-focused obesity prevention space, like Dr. Shariki Kumanika, have been reorienting their thinking and approaches based on this insight, which again has emerged from many decades worth of work and learning. So as we've been pivoting from obesity as outcome to obesity as indicator, we've also been exploring how our childhood obesity work could and should be framed and addressed going forward. And in doing so, we have to acknowledge, I think, and reflect on how historical research and policy approaches may have inadvertently contributed to stigma, anti-fatness, anti-Blackness, and other unintentional harms, and consider how insights about this evolution in combination with new perspectives and new ideas and new messages and new policy strategies and target audiences can really inform scholarship and policy action at the intersections of structural racism, food justice, and health equity. So as we all reimagine what a post-COVID and racially just society could look like, fair and equitable access, to affordable, healthy food choices for all seems consequential to the dialogue around building a culture of health. And we think now is a really opportune time for us to evolve our longstanding focus on childhood obesity to how we might be able to play a role in advancing a more just food system. Next and final slide. So I'm going to close with a bright spot from a few weeks ago. I imagine many of you are likely to have seen this article in the New York Times covering the declining childhood poverty rates. And I think this is a great example of how our childhood obesity prevention efforts collectively have had an impact on the lives of kids and families across America. Increases in SNAP funds and expanded access to healthy food meal programs have been identified as significant drivers for the reduction in poverty rates. So we all know when society makes it easy for people to receive benefits, and those benefits are flexible to their core needs, then benefit programs deliver clear and significant value. So to keep making gains, more of our benefits infrastructure could benefit from ease of access, greater total benefit package, and really give people more flexibility to meet their unique needs. Because, as the article outlines, providing more resources to low-income families changes children's life trajectories. Next slide. So those are all things that I hope we can continue to support through our work. So I will close there. I think I may have gone a little bit over 15 minutes, so apologies. With that, I'll turn it back over to Allison and look forward to joining in the conversation after my next two speakers.
Great. Thank you so much, Jamie. Really appreciate your thoughts on the work that has happened and will continue to happen and how we can move the work forward together. With that, I'm really excited to introduce Andrea Palmer. She is a program officer with the Pritzker Family Foundation's Children Initiative, supporting work with states and communities across the country to meet the Pritzker Children's Initiative's goals related to expanding equitable access to high quality services and supports to at least 1 million infants and toddlers and their families by 2023. With a public health lens and over 30 years of experience in Illinois state government, Andrea has a wealth of expertise in the development, implementation, and administration of systems, services, and supports for families at risk for poor health, educational, and economic outcomes. Welcome, Andrea.
Thank you, Allison. Thank you for having me, and I'm honored to be in your company today. Next slide. The J.B. and M.K. Pritzker Family Foundation's Children's Initiative has a vision that every child is thriving and flourishing at age 3, and that every family has access to the resources and supports they need to help their children thrive. Science tells us that if you can assure that the mother or birthing person is as healthy as possible entering into pregnancy and is getting the right supports and care during the prenatal period, the child is more likely to be born healthy. And then by providing the right services and supports to the parents and baby within the context of their family and community, you are likely to put them on a trajectory that can positively impact the baby's health and wellness into adulthood. Our North Star is every child thriving and flourishing by age 3. Next slide. Evidence shows that when we invest in the first 3 years of life, infants and toddlers become healthy children who are confident, empathetic, and ready for school and life. And our communities, workforce, and economy become stronger and more productive. We know that we can't achieve our North Star on our own. It's going to take a national effort. So we have a tipping point strategy, engaging and supporting innovators and early adopters in the work with the goal of creating a groundswell movement that others across the country will join. Next slide. For the past 3 years, we supported 20 states and 11 communities to engage in multi-sector collaboratives to plan and implement policy agendas aimed at assuring that by 2023, 1 million additional infants, toddlers, and their families would have access to high-quality services and supports in the prenatal to age 3 space. We've achieved that goal ahead of schedule, and now we're deepening our work in asking states to engage and work with families to identify the systems that need to be created and restructured to ensure that families, particularly those who have been furthest from opportunity, have agency and access to what they want and need to help their children flourish and thrive. Our big, hairy, audacious goals for the next phase of our work are that by 2027, 100% of families with children in the U.S. will live in states and communities in which significant new public resources, and policies result in prenatal to 3 supports. And also that by 2027, 100% of families living within PCI-funded states who live in communities that have been historically underinvested in and are therefore marginalized, are connected to the resources they want and need so that their families can thrive. Next slide. As we think about the systems that need to be in place to assure that children are flourishing and thriving by age 3, we knew that we had to think beyond traditional early childhood issues like home visiting, childcare, and early childhood education to consider the multiple sectors and systems that impact the lives of infants, toddlers, and their families, including economic security, housing, health, and nutrition. And so we did our research, and here's what we learned about the impact of nutrition and growth on growth and development. This won't be news for you, but for us as a catalytic funder, these were the nuggets we needed to embrace to move us to the decision that nutrition insecurity was a space that we needed to be in. Nutrition insecurity has a direct impact on physical and mental health status, educational attainment, and life expectancy. Nationally, 14.8% of households with children had nutrition insecurity. Children with nutrition insecurity in early childhood were more likely to be less prepared to start kindergarten compared to children from food-secure homes. Timing of nutrition insecurity matters. Nutrition insecurity in infancy and toddlerhood predicted lower cognitive and social emotional skills and kindergarten skills that predict later success in academics and life. The more episodes of nutrition insecurity, the greater the impact. 1 in 3 nutrition insecure adults are also obese, and that maternal obesity is associated with complications in pregnancy, including increased maternal and neonatal morbidity and mortality. Next slide. And so again, as a catalytic funder, why is it important for us to be in this space? Because we care about birth outcomes, not just for the baby, but for the mom and the baby dyad. Because of the negative impact of nutrition insecurity on health and learning, because food insecurity impacts at least 1 in 10 families in more than half of our PCI-funded states, and because justice, equity, diversity, and inclusion are at the core of everything that we do. Next slide. Our partners are working within their areas of focus to enhance the conditions necessary for infants, toddlers, and their families to have access to the services and supports necessary to achieve food security. Nearly half of our PCI-funded states and communities are working collaboratively with their state, community, and local partners on strategies to improve nutrition security, including increased access and utilization of WIC and SNAP. The Prenatal to Age 3 Policy Impact Center at Vanderbilt University has created a roadmap of evidence-based policies and strategies states can implement to foster nurturing environments and promote equity for infants, toddlers, and their families. The roadmap recommends states reduce the administrative burden for SNAP by assigning 12-month recertification periods, simplifying reporting for eligible families, and offering online services. According to the Policy Impact Center, 26 states have implemented this policy on some level since 2020, before which there were none. The 1,000 Days Initiative of FHI is working to build a multi-sector support and alignment around the importance of nutrition during the first 1,000 days, a powerful window of opportunity for tackling undernutrition and improving maternal and child health. The first step in the initiative will be a comprehensive picture of the state of the science, research needs, and a policy agenda for optimal maternal and child nutrition in the United States through a dedicated series in the American Journal of Public Health. I'm beyond excited to share that the first 3 papers from this series went live on Monday, and the full series will be released on October 26th. The National WIC Association is working with states to increase participation in WIC by families with infants and toddlers by convening a management task force to assess challenges and opportunities at the local and state levels, developing training, workshops, and resources to increase the knowledge and capacity of community partners and key stakeholders, and piloting a fellowship program to embed WIC expertise and support at the local level. And the Urban Institute which is working on an analysis of the utilization of public benefits, including WIC and SNAP in one of our states. Through literature review, key informant interviews with national subject matter experts, community and state partners, the Urban Institute will develop an initial analysis of the value of unclaimed benefits within the state and a list of strategies for improving access and utilization. Next slide. What are we learning? A lot. We look forward to the ongoing work of the 1,000 Days Initiative as they seek to build consensus around a policy agenda for nutrition security in the first 1,000 days of life. We've learned that the underutilization of public benefits like WIC and SNAP are likely due to a myriad of reasons, including difficulty navigating systems to access benefits, administrative burden being a barrier to the retention of benefits, and the perceived value of the benefits available. That nutrition interventions in the early childhood education setting can be a lifeline for families and play a critical role in creating an overall support system. Increasing access to the child and adult food care program is a promising opportunity for impacting nutrition security within the early childhood education child care center environment. That breastfeeding is one of the most powerful interventions for the health of a mother and baby. The early childhood education community can be a source of information and a welcoming environment for breastfeeding parents. And at the end of the day, are we really thinking about the upstream strategies to address nutrition security? What are the structural and institutional policies and practices that limit access to nutritional foods? And how are we supporting communities and working cooperatively to identify and meet their nutritional needs? Examples would be community gardens, the Black food sovereignty movement, and other culturally congruent strategies. The role of catalytic philanthropy, and all of this is another question we're tackling. We thank Nemours for their work, and we look forward to continuing to learn from all of you. And I'll turn it back over to Allison.
Thank you so much, Andrea. We really appreciate that. I'm looking forward to delving into all of this as we get to the discussion point of the conversation. But before we get there, I want to take the opportunity to introduce Colin Peckeren. Colin is a program director at the Grantmakers in Health, who is responsible for healthy aging and healthy eating active living programs. Prior to joining GIH, Colin was the senior policy analyst at the Children's Dental Health Project, where he conducted policy research on a wide range of oral health issues. And before that, a director at the National Association of State Board of Education's Center for Safe and Healthy Schools, where he provided policymakers and state education agencies with resources, technical assistance on child and school health issues, including childhood obesity, school nutrition, physical activity, school violence and safety, and HIV/AIDS prevention. With that, let me turn it over to you, Colin.
Well, great, Allison. Thank you so much for that wonderful introduction. I'm so glad to be here with you all today. And it's great. It's got a chance, Andrea. It's a pleasure to get to meet you, and it's a pleasure to be here with my friend Jamie, who was actually a program officer of mine way back when I was at NASB, doing a lot of that early childhood obesity work. So we've kind of been in this about the same length of time. And like her, been thinking a lot lately about sort of where the field has been, where it's going. And so I'm really happy to get a chance to share some of those thoughts and insights with you all today. So my hope is that I can give you all a bit of sort of where philanthropy has been historically in terms of funding some of this work, some observations and lessons learned and trends that I've observed in my time here, which has been almost 11 years at Grantmakers in Health, and maybe some insights into where philanthropy may be going and what that might mean for all of you on this call and beyond. So we can go ahead and hit the next slide, please. Have to do the obligatory about us, since many of you may not be familiar with Grantmakers in Health. We are not 50 years old like our Robert Wood Johnson, but we are celebrating our 40th anniversary this year as a nonprofit educational organization dedicated to helping foundations and corporate giving programs improve the health of all people. Really, our goal, our mission is to foster communication and collaboration amongst grant makers and folks like you on this call to help strengthen their grant making knowledge, skills, and effectiveness. We work with directly and are supported by over 200 funding partner organizations. Those are sort of our members, but we're not a membership organization because we do have the mission to serve the entire field of philanthropy. But let's go ahead and hit the next slide here. So I think a lot of what I'm about to say here, you've probably heard a little bit from both Andrea as well as Jamie's presentations, but my hope is that sort of giving you a sort of a step back from individual foundation perspectives might give you sort of a broader sense of sort of what's been happening for the past 10, 15, 20 years or so in terms of the field of philanthropy. So like Jamie rightly said, and she was not, Robert Wood Johnson's not alone in this, at the beginning at around 2001, 2002, when the Surgeon General declared the childhood obesity epidemic, and the initial research came out showing those BMI trends that I'm sure we all have seen in different CDC presentations. Early childhood wasn't really a focus at the start. It really wasn't until about 2009, 2010. And I'm pretty sure it's for two main reasons. I think first, as many of you know, K-12 is a lot more centralized, established system. It's sort of, there's a bit more there to interact with, both in terms of policy and practice and programming, compared to early childhood care in the United States, which is a lot less centralized. It looks very different from state to state, if not even from county to county in some cases. And so I think for a lot of funders, it was a difficult ask early on when we were first starting to do this work to really engage in early childhood. And also, I think a big catalyst around 2010 is that's when you really start seeing a lot of the research coming out connecting maternal weight and early feeding practices to childhood weight trends, and also behaviors around healthy eating and active living. And so a lot of the early work, two foundations here who have certainly been doing this for some time, did focus around breastfeeding and maternal health, again, because that research really was showing those connections. And while it wasn't necessarily a new area of funding for health funders, I think that the connections to childhood obesity really ramped up and brought new funders into the space, and sort of we're looking at it from a different perspective. Likewise, childcare settings and pre-K settings really became a focus for a number of health foundations. Robert Wood Johnson, certainly Nemours, Blue Cross Blue Shield North Carolina, the Kellogg Foundation, New Hampshire Children's Health Foundation, many others. Those are just a few examples, really did start to do a lot of different interventions in that space. So, and I think a lot of it also, we're carrying a lot of lessons from the K-12 programming interventions and policy. So where you had, for example, farm to school programs trying to engage with local producers to bring fresh, healthy produce into school meals. You have the farm to preschool program, which is, of course, still running very strong with folks like Kellogg and Robert Wood Johnson and others, funding a lot of aspects of that work starting to emerge. We've heard mention already about gardening. That certainly school gardens were a big early intervention a lot of funders were partaking in. And certainly that started to then get to apply to early childhood care and pre-K settings as well. And an interesting sort of policy sort of bent on some of this work was sugar sweetened beverages. It's sort of easy to forget with all the soda tax work that's going on these days that a lot of the early impetus for that work was around early childhood spaces and early childhood obesity prevention, in terms of trying to reduce drinking fruit juices and trying to go towards different more healthier beverage options. And so a lot of that early work that sort of broadened started in the early childhood space for a lot of funders. And same thing with physical activity, where you might have had recess in the K-12 space. A lot of funders focused in on playtime and reducing screen time. But let's go ahead and go to the next slide, please. And so just a couple of other things that were funded that the funders have been involved in. A few of these haven't been mentioned yet, but assessment tools. While there was a lot of work done in the K-12 space in terms of assessing the physical activity and nutrition environments, a lot of health funders, or some health funders, really were involved in some of the early work around early childhood spaces. For example, you had Blue Cross Blue Shield of North Carolina Foundation funded a lot of the earlier work around UNC's nutrition and physical activity self-assessment for childcare, and did a lot of the early implementation funding, so that that really became a tried and tested tool for these types of environments to assess where they were and the types of things they could do to improve healthy eating, active living in the early childhood space. A number of funders also around family visitation programs, and early sort of campaign messaging towards families to pay attention to nutrition and to activity was done. You had folks again, like the Colorado Health Foundation. Robert Wood Johnson funded some of this early work. Jamie mentioned some of the home visitation work that they were doing, as well as the Horizon Foundation in Howard County, Maryland. Did a lot of work to try to do outreach to young families and mothers around the importance of their eating and activity habits and how that was going to impact the health of their children. And it's been mentioned a few times, a lot of the work is sort of, where it initially started with the individual behavior change, really did start to shift towards trying to do the silo breaking, cross-sector collaboration. So Andrea already mentioned the First 1,000 Days initiative, which is, of course, still going strong. A lot of folks like the Boston Foundation, very early on, were thinking about that, how they could bring healthcare and other leaders from other sectors to focus in and around community health, and looking at how things like WIC grants and other community programs could be better coordinated and collectively trying to improve the health and behavior outcomes for mothers and their children. Also, you have founders at this point like the Greater Rochester Health Foundation, who were doing a lot of regional planning coordination across their communities that they were serving in upstate New York, around how different sectors could be coming together around the common goal of improving outcomes for young mothers and young children. And a lot of this was starting to get tied into school readiness, again, sort of also bringing some of the economic perspectives and interests into this work, given that obviously, if children are coming to school hungry or are having other issues, drastically was impacting school readiness and, of course, future educational outcomes. We go to the next slide, please. So I want to quickly cover a few observations and lessons and things that I think are worth noting, sort of given where the work is going and sort of where it is right now for a lot of funders in the Health Foundation community. The good news I like to start off with here is that we have a sort of, as you sort of saw there's a lot of different places where health funders have sort of put their dollars, and that has not changed. If anything, as time has gone on, the field has become a whole lot more diverse in terms of how they are spending grant dollars and where they are focusing their work. But regardless, through and through, based on the research we've done here at Grantmakers in Health and the ongoing one-on-one conversations I've had with funders up to the present day, is that there's a broad recognition that this is not a 3 or 5 year initiative that's going to fix any of this, that this is more akin to smoking cessation, that this is going to be multi-decades worth of work, and funders through and through for the most part have acknowledged this and have put their money where their mouth is in that regard. And so we have not seen a whole lot of funders leave this space and are still committed, whether sometimes that commitment has changed in terms of what the focus has been, but regardless, understanding that this is going to take a long time in order to see results, especially population level results. So the next slide, please. We've talked a little bit about the pandemic, but in talking with funders, the pandemic really has focused folks' attention on systems and access. As the pandemic stressed our food system and institutions, sort of as we sort of saw a lack of institutional access for families, whether it was through child care programs, summer meals, school meals programs, really did see that there was an important need to shore up not only those programs, but certainly to the emergency food system in order to provide nutritious food to especially families most in need, low income, communities of color, BIPOC communities. And so a lot of funders have started to pay attention to that and were very responsive to those needs because they were hearing them directly from community leaders. Interestingly, a lot of those same funders I talked with, a number of them who were not necessarily new to this space, I think were very surprised as to how broken our food systems are and can be. And so a number of them saying that they were really thinking at their foundations that they were going to have to think, sort of doubling down on their investments into food systems, and whether it be around procurement or distribution, or other supportive programs. But that is very much a space that I think funders are going to be continuing to pay attention to as we sort of hopefully move into this post-pandemic world, depending on how you define that. But we can go ahead and move to the next slide, please. As both of my previous panelists mentioned, a lot of funders are starting to look upstream and the different connections that obesity prevention has to a number of different issues, whether it is housing, whether it's education, access to healthcare. Really, the social determinants of health are driving a lot of funders in terms of how they're focusing. As funders have started to think about in the early childhood space around things like adverse childhood experiences, it's become increasingly clear that nutrition security, access to spaces where kids can be physically active in safe spaces, those are part of a larger web that's influencing outcomes across the board for children. And so it's hard to sort of look at these issues as sort of discrete siloed issues, but as part of a larger web of social determinants. And so a lot more health funders especially are taking that lens to this work. And I think that is only going to continue to drive a lot of the focus in health philanthropy. Next slide, please. Because we're certainly here today to talk a lot about issues of equity, the good news is a lot more health funders, while a lot of the work in the field, of course, recognize disparities in terms of access and quality, whether it was in terms of being physically active or to nutrition in terms of food deserts, food swamps, more and more realizing that there's a lot more work to be done. And it's also equally, if not more important, that the communities that are suffering from these disparities, BIPOC communities, be at the decision-making table, that they are empowered to be part of the solution and not just sort of a partner that's brought in once the solution's been decided upon by whether it's a foundation or a government or whoever is the one driving the work. And so you hear a lot more in philanthropy, the term trust-based philanthropy, the idea that the communities, the organizations that are really leading the work need to be empowered, whether it's through general operating grants, unrestricted funds, and other mechanisms so that they are equally part of the solution, if not more so, given that they have a wealth of experience and perspective that are going to be truly important to finding long-lasting solutions that are going to be adopted and embraced by these communities. And so a lot more health funders are thinking about this. Certainly, there's a lot of work to still be done. Different funders are in different levels of the journey. And so I think it's incumbent upon all of us, certainly grant makers in health, as well as everybody on this call, to make sure that we continue that trend and certainly help our funders to navigate those waters. Next slide, please. Just one final thought I have here, and something hopefully we'll maybe be talking about when we get to the discussion a little bit, but supporting of clinicians is something I think that we're going to be seeing a lot more work, and there's a lot of funder excitement around. It's not new. We did a lot of programming here at GIH, and certainly there was a lot of talk in sort of pre-pandemic days. But I think given the current climate and sort of where the focus is for a lot of health funders, I think that there is sort of a return to this being a focus, which is for example, food as medicine, so a prescription RX program or food prescription programs, medically tailored meals, a lot of different interventions where we do see food as being part of a larger solution to health outcomes. And a number of funders are really starting to double up or reinvest their resources into programs like that. There's certainly a lot of discussion amongst funders around how we can better reimburse or reimburse at all for different interventions that are going to improve nutritional and other outcomes related to nutrition and obesity prevention in the doctor's offices, as well as the fact that a lot of physicians still to this day maybe get one day of training around nutrition and other obesity prevention related issues. And so that there is still a great need to support them in being better partners in these solutions. And Medicaid 1115 waivers, especially, I think, are an area where we're seeing a lot of great philanthropic leadership. So in North Carolina, for example, you have Blue Cross Blue Shield of North Carolina, the Duke Endowment, and a few other funders who are really helping to lead conversations around screening for food insecurity. And those funders are very much trying to drive not only counting and understanding who is food insecure, but also connecting these families and these individuals to services, whether it be food RX programs or food pantries or others that could provide the supports they need to become have access to healthy, nutritious foods that will obviously impact the outcome for their children as well. So final slide, please. So I am very much looking forward to the conversation we're about to have. Please do feel free to get in touch with me if we have any questions or if there's any way I can be helpful. But please, thank you so much. And I'm going to turn it back over to you, Allison, so we can start the best part of this call, which is the conversation and the Q&A.
Great. Thanks so much, Colin, and to all of the speakers. I'm always amazed at the work that is going on and love seeing it come back to life through presentations like this. So I see all of the faces have come back on video, and thought that we could start off with some questions. It's been a busy week for nutrition, as we all know. But before we delve into that, you all talked a lot about the sort of multi-sector approach that's happening, the systems changes that are happening to move this work forward. And it's not health philanthropy alone at this point, it's education philanthropy, it's community philanthropy. Can you talk a little bit about, as philanthropy deals with crossing the sectors of its own field and how you're funding in the field itself to really take on all of those issues? What are some of the priorities that are coming up for the communities that you are working with, and how are you addressing those as philanthropy?
I will defer to my philanthropic colleagues to start this one.
So maybe I'll just, I'll jump in on a couple thoughts, and I think it goes to like the move to the field that I heard Colin referencing also, like moving upstream. And I'll say, and this is not going to directly answer your question, but I think today more than ever, we understand that, well, healthy eating and physical activity is critically important in terms of health and well-being and weight trajectory. As important is whether or not that child has a safe place to call home. Does mom or dad benefit from the kinds of family support policies we know need to be in place in order to ensure that that child can thrive? Is there access to high quality early care and education opportunities, health insurance, health care, and on and on and on. And so, like, I just lift up one example. We're talking a lot at the enterprise level, at the foundation, around economic inclusion. And what does that look like? And what does it look like to close the racial wealth gap? And what does it look like? So one example that's sort of top of mind, because, as you said, Alison, it was a busy week for nutrition, hunger, obesity, chronic disease. There's a lot of work that remains. We have 10 million kids who recently lost access to school meals. We have, the average SNAP benefit before the pandemic, I think, being like $1.40 per person per meal. And although we've had recent increases in the maximum benefit, still not covering the average meal in 20% of counties in America. And healthcare and productivity costs associated with hunger far exceeding our investments in it. We have the child tax credit that was a game changer, and that unconscionably was permitted to expire, I'll say. And so we have tools in our toolbox that could actually mitigate a lot of what's happened as a consequence of COVID, disinvestment, structural racism, all of that. And I think the child tax credit is an important piece to sort of lift up, because that actually reduced food insecurity almost immediately, and lifted more than, I think, 3 million kids out of poverty. And so again, just to say, there are measures that we could put in place that could transform the lives of kids and families, and I think we just need the political will to do that. And we'll see, ultimately, changes in trajectories around weight and health of kids and families as a consequence of some of those upstream policies that we might not necessarily have thought about as obesity prevention policies. I don't think anybody thinks the child tax credit is an obesity prevention policy, but actually it is. And I think it goes to sort of this need to move the field upstream. And apologies, there's obviously dogs in the background, so I'm going to go on mute and let my colleagues chime in.
Thanks, Jamie.
I completely agree with everything that Jamie has said, and I think that for us, we are a traditional early childhood funder, and so it was really important that, and also we're a catalytic funder, which means that we don't have the deep dollars to go the distance that needs to go. So we have to really think about, where are the opportunities and the gaps? How can we leverage, or how can our dollars be leveraged to move the work forward? And so I think that's what you see in the examples that I provided of what we're funding right now. And it's unlikely that we would ever fund an actual farmers market or anything like that, but we might fund a state advocacy agency, maybe to do some policy advocacy around a need that a community has, or we might engage some of our partners who may not traditionally be thinking about nutrition, and encourage them to think about how does nutrition help them to achieve their goals and the impact of food insecurities on the outcomes that we're trying to achieve. So to answer the question in terms of how we're thinking about this from the perspective of that we are cross-sector and trying not to get in each other's way, but instead to sort of create some synergy and lift each other up.
Yeah, and I'll just second both my colleagues there that I think it is a really exciting time. And I think we're at a point in this work in philanthropy that we are really seeing those interconnections. And I think that there's a lot more will amongst funders to really work not only across philanthropic sectors, but also certainly in the communities that they're serving. And so I think that whether it is looking at the economic issues in terms of the child tax credit, or whether it is looking at things like transportation, where our mother's able to get to out of a food desert, or are able to get to the doctor's office in order to receive the proper prenatal care that they need. So I think it's sort of the sky's the limit. I think the tricky part is just I think, and one of the great roles that philanthropy can play is just helping to foster those communications and find those really points of strategy where it makes the most sense to sort of be focusing cross-sectorally at a given point. And so I think that the tricky part is there's just so much happening at once. It's sort of where do you begin? And so, but I think that's a better problem happening than not.
Sure. And I love the terminology that was just used in your answers, whether it was synergy or leveraging, catalytic, and really thinking about the government initiatives that are underway, the policy initiatives that are underway, and how to leverage those to make change. I think you all hit on a number of topics that we are all working to figure out how to best use. With that in mind, and the assumption that you all spent Wednesday in a similar way that I did, trying to reload YouTube to watch the president's White House conference on nutrition, food, and health, the first time in 50 years that really people were brought together to come up with a national strategy, the release of the national strategy around hunger and food insecurity, and a long list of commitments from public-private partnerships about what can be done to really help move the dial on this. What do you all see as opportunities to really move and leverage on that? A quick read, early childhood was not a large part of the list of commitments. And yet at the same time, there seems like there's an opportunity here to really continue to foster the acceptance of the idea of childhood as starting at birth, not at grade K. And thinking about how we can leverage commitments and opportunities to ensure that all children from birth through their education have opportunities to really be well, and that those opportunities are equal, and that we are thinking about this with an equity lens going forward. So what excited you? What made you think this is someplace that we need to look? Are there any concerns that you have? I open the floor just because it's such an important topic that happened to be really timely with this webinar.
Yeah, no. We had the pleasure of sending a sign-on letter to the White House in support of this. And the good news is we talked a lot in our letter about really looking upstream in terms of the social determinants, essentially, of what in terms of like poverty and other things, in terms of how it impacts people's ability to be healthy and be active and reduce obesity. So I was encouraged to see a lot of the things that we brought up were in there, and some of the things I just mentioned in terms of working with healthcare systems and providers to be part of the solution, to think about health or food systems in terms of the fact that we have a broken food system in many respects that certainly needs to be repaired and to be reoriented. But no, I thought a lot of things were encouraging. I think it's just a lot of the policy issues, whether it's expanding eligibility for SNAP, WIC, Medicaid, whether it is increasing funding and certainly making universal free and reduced meals a reality in schools. All are very encouraging. I think there are a lot of things there that I think the field we're hoping would be on the agenda. But I think that now the challenge is going to be seeing whether there is the political will and whether we can sort of help take it home and actually see these policies become a reality. But I'll stop there because I'm really interested to see what Jamie and Andrea have to say.
So I had the good fortune of being there on Wednesday, and I think for me, a couple things. I mean, one of the most powerful parts was speakers bravely sharing their lived experiences of going hungry, the trauma of not being able to feed your children, that these are real stories of real people in America. And I'm saying all that because there's a troubling, letter in the Wall Street Journal about this. And I think we need to continue sort of the discourse around this. So that was really powerful. I think the notion that hunger nutrition and health, like there is nothing partisan about like those issues at all, period. And so you had enlightened Republicans represented and speaking, you had enlightened Democrats represented and speaking, you had real people really centering community voice. And so I just, I'm hopeful. Again, I think to Colin's point, without congressional action, I don't know where all of it goes, but certainly I think the national strategy is really strong on hunger. A lot of the recommendations that are being put forward certainly align with the kinds of things that we've been promulgating for a long time. I know we're talking about early childhood, Allison, but I can't help but to like harken back to like across the day, universal school meals as a really important way of mitigating a lot of the suffering that we're seeing and addressing hunger. And I think there's just a lot of optimism that we all have a role to play here, sort of an expectation that we all go home and start doing our part or continue to do our part. And the hope that this is sort of a historical moment that'll be, as transformational as the first event was 50 years ago. So, I think I'm optimistic, but I also think that we need to continue to make sure that these stories get told. And the fact that food insecurity and hunger is a real issue in America. And I don't like to say capitalize on the consequences of the COVID pandemic, but I think, hunger in America is not a new issue. Hunger has plagued America for a really long time. I think what is new is the sense of urgency. And I think that was pushed in the discourse on Wednesday. And I hope that that'll continue to be front and center for people and policymakers alike.
And I agree with everything that you both said. One thing I would like to add is to think about it, and Allison, you mentioned thinking about it at birth. I'd like to push us to think about it prenatally and the importance of not just thinking about, how the baby is fed, but how mom is fed while she's pregnant and her being as healthy as possible even before the pregnancy and the impact that has on outcomes.
Thank you all. I mean, I think, one of the comments that stayed with me the most from that conference is no child should be going to bed hungry in America. That is a given with the resources that we have. And Jamie, to your point, there was a ton of talk about school lunches and free lunches, and we saw what happened during the pandemic about how it increased access. And I think that's one of the areas too where we can push, right, and say CACFP for providing food in early care and education settings has to be part of that conversation as well, so that we're ensuring that we're getting those kids to kindergarten as healthy and ready to learn as we possibly can as well. So a great opportunity to bring that conversation to us. And so I want to be mindful of time, and we do have a question from our fearless listeners out there. And if you have a question, I encourage you to add it to the list. I did see a hand up at some point. I couldn't tell who it was, but please add your question if you had a question to the Q&A. But this is from Bonnie Williams, a good friend of ours in Arizona, who asked, it seems to me that many public health and early education conversations are coming together more than ever. As a state health agency that's trying to reframe health and wellness using trauma-informed approaches, for example, removing stigmatizing terms such as obesity, healthy, unhealthy dichotomies, and shaming language, do you have suggestions on how to work with the current national landscape and terminology while at the same time promoting a more supportive approach?
So I'm sitting here like feverishly, in agreement, I'll say at RWJ, we are really interrogating the messages that we put out, our role in potentially contributing to biased mental models and stigmatization. We're interrogating, I think there's increasingly clear evidence that body weight itself and the tools that we have historically used to measure body weight, like BMI, are not the unbiased markers of health that we've often treated them them as. And so I think like lifting up those issues and sort of stepping back and thinking about framing and messaging just feels ever more important. And it's something that, you know, we're doing and we're going to be, I hope, like learning a lot about. There's been a lot of writing now around anti-fatness, anti-Blackness, and we have a lot to learn. And, you know, we're on this journey around figuring out like messaging and communications matters, and it matters in really profound ways. And so again, you know, I use BMI just as an example that we have used to help us gauge like how well we're doing on moving the needle. And that reliance, I think, has reinforced or further stigmatized kids and adults. And so we have a lot of work to do around, you know, figuring out like what are the best measures? Like, how do we talk about this in a way that, you know, continues the momentum around this, but yet starts to mitigate some of the stigmatization that I think none of us in the field would ever have wanted to have had happen, but has happened. And so again, I don't have a direct answer other than to say, I think we have a lot to learn and it's high on our radar. And I think you'll see our State of Childhood Obesity report, which will be issued again for the 4th year in November. And it's going to look a whole lot different than it's looked in the past. And so we'll be eager for the field's feedback about that as we seek to get it right and acknowledge like how we've gotten it wrong historically. And I think that's a start.
I agree with you completely again, Jamie, as usual. And I think it actually goes back to a comment you made in your presentation when you talked about really thinking about the structural racism and how that has contributed to the outcomes that we're seeing. And it really is similar to blaming the victim. It's like I heard I was listening to a webinar and they were talking about food deserts and renaming it food apartheid, because it's not so much a desert as opposed to, because of the policies and the systems that have been created, this has been the outcome. And so the fact that a person lives in a community where they don't have access to what they need, and as a result of that, this has happened to them. And then we need to really rethink how we talk about it.
No,
Can
absolutely.
I just, oh, sorry, Con, I just
No,
wanted to
go ahead,
build on
Amy.
that, Andrea, because I think it's a really important point. Like, we need to be changing our language and calling it food apartheid. By calling it a food desert, it's sort of like that inadvertently has happened. It's sort of happenstance. Like, actually, that is by design. And so until we acknowledge that and acknowledge the role that we've played in that, like, we will not get where we need to be going. So I do think, to your point, Andrew, like, we need to be calling it food apartheid. That's what it is. And we can look at the racism across every element of the system, from production, like from land acquisition to marketing and advertising. There are so many places across this continuum. And I think that language does matter, how we talk about it, think about it, and then put forward solutions to like address those issues. So I just wanted to echo that. Colin, sorry.
No. You said a lot of what I was going to say. That like redlining, this is a very intentional system. And we could, have a whole webinar about systemic racism and how it's impacted, health and health outcomes. But no, I do think that, and it's funny because you do hear people that, on stage at Wednesday's conference who still refer to things like food deserts and whatnot. And so I do think that there is probably some effort, and Philanthropy certainly maybe has a role to play here in terms of really sort of reorienting our language, because language does matter. It does say a lot about how we direct our funds, how we direct our energies, and how we approach things. And so if we are going to do that in a meaningful way, in an equitable, trust-based way, I think that we really do need to sort of re-examine how we do talk about these issues.
You know, I often hear like so many people speaking about how broken the food system is, but in fact, the food system functions exactly the way the food system was designed to function, to be extractive, exploitative, racist, and on and on. And so, yeah, I think it's like an opportunity for us to like unpack this, dig into it, and acknowledge that, like, you know, instead of supporting strong communities, healthy kids and families, like it's exploiting workers, it's worsening racial and income inequality, it's draining money from local economies. And instead of working with nature in like resilient, sustainable ways, it's contributing to the ills of our planet also. And that was a theme that I think came up on Wednesday too at the conference.
Yeah, and it's tricky because philanthropy, I think by nature, we like the idea of that we're going to work across aisles, that we're not going to try to, have anybody that feels like they want to be at the table feel like they shouldn't be, because there are certainly sectors of society that would be uncomfortable with some of the things we're talking about right now. And so I think it is sort of, but we have to sort of acknowledge that perhaps, that saying and doing the right things may be more important than having everybody at every table. So it is a tricky thing to balance, and it's something that philanthropy has had to struggle with on a number of different issues for a long time.
And I think language also sets the tone for whether the collective we believes it's actionable or sort of just set. So to your point, things don't just happen, but the language may make it sound like they just happened, and therefore there's not as much action to be taken. So appreciate all of that in this really great discussion. Being mindful of time, I want to thank you all. There's a couple of questions that I'm just going to direct. One from asking about the role of childcare providers in food insecurity, and can you talk more about that and what recommendations or ideas you might have about this? I'll open it quickly to you all, but also say that I hope you tune in, Kim, who asked the question for our October 26th webinar, where we're going to talk about a lot of innovations that are happening in childcare to take on this issue of food insecurity. But quickly, any of the speakers, do you have any ideas or great ideas that you've seen happening that you want to make sure come out in this webinar?
And I'm looking it up because I'm not an expert, but there is that, what is it, a child and adult food program.
Yep.
That would make early childhood educated childcare centers, give them resources in order to be able to provide healthy foods. That would be for infants and toddlers. I think there's also a wonderful opportunity in terms of them supporting parents in terms of breastfeeding, if we were to make sure that they had access to the information that they needed in order to share that information.
Great, thank you. And Andrea, it's like you read my mind for what the last question was, because I'm going to send someone back to a brief that we did. But David asked, who or which organizations are working on increasing the Cacfp reimbursement rate for ECE? I know of many providers who face the administrative obstacles to see that process through and are discouraged by how little they stand to gain monetarily. We agree that it's really important for feeding the children who get a vast majority of their nutrition in childcare settings, if that is where they are. And so this was actually a big part of the discussion at our policy webinar. Our first webinar, we had FRAC on, and Jerry Henchy spoke very eloquently about that. So David, if you reach out, we're happy to share that brief and to share the slides with you that talk a lot about what is happening on Cacfp and increasing Cacfp reimbursement. And with that, I just really want to thank Jamie and Colin and Andrea again for your time and this great conversation at the end. I'm always invigorated when we get to the conversation part because the passion comes out in the discussion. And so just want to tell all of you who are listening, we will follow up soon with a recording and slides from this webinar. And additionally, we will be developing a synopsis of key themes from today's conversation that we will release in a few weeks. As I mentioned, you can also get caught up on any webinars you missed in our series by reading their synopses or watching them if you really want to enjoy seeing the speakers live. Again, we hope you'll join us on October 26th for the final webinar in the series and a focus on innovation, really wrapping together what we've been seeing in policy and in research, and obviously with philanthropy, and thinking through what's next. How are we going to start to move the ball forward again, taking advantage of all the great work that's already happening in the field, and continue to address this problem to ensure that all kids have the ability to grow up healthy and well. But thank you all today, and we look forward to seeing you soon. Have a great weekend.